So sorry about the bad introductions. Next, we have a virtual or online talk. Hopefully it's all going to work. From Adaora from the Abuja Teaching Hospital or University of Abuja.
Yep, that's good.
Okay, thank you. So Acinetobacter baumannii is a global health concern, being that Acinetobacter baumannii is a critical pathogen according to the World Health Organization. This species is an opportunistic pathogen, and they are able to thrive in the hospital settings because of their ability to live on dry surfaces and their resistance to disinfectants. They are known to cause severe infections such as meningitis, bacteremia, wound infections, and they pose a significant therapeutic challenge due to its wide multi-drug resistance spread. The aim of this study was to determine the prevalence of invasive Acinetobacter baumannii and its antimicrobial susceptibility patterns among patients with sepsis. Now, this study was a hospital-based cross-sectional study conducted over a 12-month period, and the clinical samples included the blood, cerebrospinal fluid, urine, tracheal aspirates from patients with suspected sepsis. These samples were processed using the VITEC automated system for identification and antibiotic susceptibility testing. The results were interpreted using the Clinical and Laboratory Standards Institute guidelines. The results revealed that the overall prevalence of Acinetobacter baumannii among all clinical samples was 21.4%, and infections were most frequent from patients less than 10 years old and in patients above 50 years old. The highest ward-based prevalence included the adults intensive care units and the pediatric ward, which accounted for 23.4% of these isolates. Majority of these isolates were also recovered from blood specimen with prevalence of 57.2%. There was also significant resistance among common antibiotics used such as cefepime, ciprofloxacin, piperacillin, tazobactam, and meropenem. Notably, all these isolates were susceptible to colistin. This study found out that Acinetobacter baumannii was responsible for 21.4% of invasive infections among patients in the tertiary health facility. And the prevalence was noted to be higher than the previously reported Nigerian figures, which was said to be within the range of 4.6 to 9%. However, this study findings aligned with other African and Asian settings where the prevalence ranged from 19.3 to 22%. So we looked at it and discovered that this upward trend may be attributed to key factors, such as increased culture of clinical specimen, and secondly, improved diagnostic accuracy through automated systems, which offer greater sensitivity in pathogen detection. The clinical burden and the risk population of Acinetobacter baumannii is substantial, particularly because of its predilection for critical infection sites, and the bloodstream was the most commonly affected site with prevalence of 57.2%. These sites are of significant concern from an infection control standpoint, especially in the hospital environments where the organism's potential for transmission and persistence on surfaces poses an ongoing challenge. The high-risk population identified in this study included the pediatric patient and patients admitted in the intensive care units, each accounting for 23.4% of Acinetobacter baumannii. This study emphasizes the importance of targeted infection prevention control, strategies in this vulnerable group, as well as the urgent need for enhanced surveillance, as well as antimicrobial stewardship to combat this pathogen. The implication of this study include the urgent need for antimicrobial stewardship, prescription control, because here in this part of the world, we're still trying to combat this prescription control, because you see people selling antibiotics even in the park, in the car park, open the chemist and other parts of the community. So antibiotic is not properly controlled in this part of the world. However, the implication of this is antimicrobial resistance. Another implication is also enhanced diagnostic practices. In conclusion, there's an urgent call to action, because this study has revealed that Acinetobacter baumannii is an emerging common clinical pathogen with a high prevalence of multi-drug resistance, particularly among the pediatric and intensive care unit patients with sepsis. These findings highlight the need for improved diagnostic, robust antimicrobial stewardship, stringent infection control, and continuous surveillance to mitigate the spread. Thank you for listening. I also want to use this opportunity to thank Professor Linda and Dr. Prachi for their assistance. Thank you.